may I invite Dr. Kalyana Guruge and maybe Dr. Srila Aldi Silva to discuss a little bit about possible frequently asked questions, and then we'll be moving into the other resource persons. And also then Dr. Channa De Silva to mention about the possible presentation of children.
Thank you, Indika. I think it's very encouraging to see that nearly 200, well over 200 had joined the meeting today. So the objective of this this session is to educate commonly asked questions. Basically, I'm a pediatrician. So I'll be basically talking about the pediatrics, and also I'll be supported by Dr. Channa De Silva, who is a pediatric pulmonologist at AJ Hospital. Okay, Channa, can you just tell us about the commonly asked problems that you have encountered so far in pediatrics?
Yeah, thank you, sir, and thank you, Professor Indika. The thing is, most of the time, fortunately, the presentation, especially the complications, are rare in children. So one thing is, but the problem is still because of this scary nature of the COVID-19, when a patient, especially the child, the family member contacted with the person with COVID-19 or found to have the diagnosis, so confirm the diagnosis, parents are a little scared. So that is a very accepted thing. But one thing we have to stress is most of the time it's a very mild disease, so uncomplicated disease in children. And recent also with this Delta wave, possible Delta wave, as we all know, there's some increase in the symptoms, the percentage, little increase, but still we didn't receive significant children with significant number of severe disease. So COVID pneumonia in children, that's a good thing. So most of the time, if they ask about, so they are scared, but we can reassure most of the time, usually less than 1% of children develop severe disease in majority. And recent admissions to LRH also, around 75% of children didn't have much symptoms, some sort of upper respiratory involvement with mild fever with some coryzal symptoms only. Actually, majority of them could have been discharged home, but still the system is not implemented. We have to keep them. Because of that, our wards also get congested. So if a child, the one concern is that main concern is that if a child develop the disease, so they contracted disease, so it's confirmed to have the disease, parental concern is whether my child develop the severe disease. And then have concern about the symptoms of this child. So what are the things? So then again, we have to reassure them most of the time. The majority, it's as we know, the coronavirus is one of the commonly encountered virus in pediatric practice, causing upper respiratory tract infections, uncomplicated upper respiratory tract infections in children. But as we know, this corona new variant might cause some problems. That's the main issue. But still, children's, it's the complications are less frequent. So if they ask about the symptoms, so we can tell, especially children, usually they don't develop with pneumonia. Very rarely they can have, but majority just upper respiratory symptoms. They might have fever, sore throat, the same as adults, and nasal discharge, sneezing. Sometimes older children might complain this anosmia, and some of them might have body aches and little bit of malaise. And children, other thing is they can also develop GI symptoms as well, maybe around 10%, but still we don't know with this new variant what is the percentage. But usually we didn't see much of children presenting with severe significant diarrhea, vomiting, but that also can have. So those are the main symptoms developed in children with COVID-19 confirmed disease. Then as we going towards this home management, especially with children also, it's officially recommended to do this children over 2 years of age. So then when we contact, or especially when we are implementing this, but most of the time they admit to hospital because of this care. Parents are scared, but hospital also after assessment, until now we are keeping these children, but still now even LRH we are trying to discharge as soon as possible without keeping them for 10 days, because most of the time they are stable. So these parents also might contact you, might ask some questions. So one of the important thing, other thing is when to identify complications. So parents, especially they are worried about the things they should monitor at home. So the thing is, as we deal with children, so they are active, very playful, normally. So one thing is we have to monitor is, or the ask from the parents is whether they are active or playing well, or they are usually whether they are living in their usual way. If they are refusing foods and they are lethargic and the malaise, and they're having vomiting or diarrheal illness or fever persisting at home, or the urine output was reduced significantly, or they develop any other concerns. But usually, as I mentioned earlier, they don't develop COVID pneumonia in majority of patients. Because of that, they don't develop this dyspnea or other symptoms like in adults. But main thing is the persistent fever, feeding issues, as well as their activity issues. But if they develop breathing problems, tachypnea, tachycardia, so we might not ask, we cannot at home about tachycardia, but obviously we can ask from parents the breathing, whether they are having some breathing difficulty, fast breathing, as well as small children. We can see recessions. If they are taking some extra effort in breathing, those are very alarming signs. So those children invariably have to direct to a the closest hospital. Other thing is about the drugs. So this is in adult patients also. It's one of the very frequently asking questions. If they diagnose as disease, what about the drugs as well as this the vitamins? Really speaking, so children's mild disease, some coryzal symptoms, if they have fever, only paracetamol is indicated. Sometimes we might use some appropriate antihistamine. But otherwise, home management, they should not give any drug to these children, especially NSAIDs, steroids, and antibiotics. We know that often they are using this azithromycin and some antibiotics, but that should not be encouraged, especially in home management. If they if these children really require some sort of steroids or any other medications other than paracetamol, they should be in a hospital. So very clear, they should not take any steroids or any antibiotic or any other drug for COVID. Vitamins also same, because there's no indication to give vitamins for these children, because most of the time they don't have vitamin deficiency. So extra vitamins might not cause any additional benefits. So giving so that is also not indicated. We should not encourage them to use these things. And about this steam inhalation, that is another thing very popular these days, but it obviously it doesn't kill the virus, or there would not be any significant impact on the disease, especially the natural history of the disease, and there is no any scientific evidence whether it's beneficial. Sometimes if a child has some sort of nasal condition, especially again older children, they might get some sort of temporary symptomatic relief, but definitely it won't alter the course of the disease. So that's also we should discourage, and unnecessarily child might end up with some accidents as well, like burning issues. So then the other care of children, especially the bathing and foods. So the children, one of the main thing is bathing. So if I think better to ask them to wait for a couple of days. So it's very difficult to give a very clear answer because all are subjective. But otherwise, definitely there's no contraindication for bathing. And foods also, they can give the usual foods. Especially they're asking about whether they can give eggs, meat, and other. Usually our traditional practice, when they have some sort of this type of communicable disease, usually they don't give these animal foods, but obviously the nutrition is essential. Because of that, their usual foods they have to continue. So basically these are the main thing the parents are worrying. Other thing, the practice of face mask, and especially if the one of the family member having the disease and the adult patients having staying at home, and how to care these children. So it's very difficult to prevent them going into, especially if one of the parent having the disease, it might be practically difficult to isolate them, but still children also can wear face masks. So the CDC and the international cutoff age is 2 years. All children about 2 years can wear face mask, and when the adults give this example or wear it properly, usually they are wearing it. So even the initial phase of this disease, people had some doubts whether it's possible to ask the children to wear face mask, but obviously they are wearing because they are very fast learners. There's no issue as much as possible. If there's adult patients at home, if the child didn't develop the disease, so better to ask the child to wear face mask effectively if there is an encounter less than 1 meter. Other thing is about the playing and other activities. I don't think we should restrict those things unless there's some sort of strenuous exercise. Now these days, best thing is ask them to stay within the home as much as possible, and the ventilation and the home other environment are all same. There's no special thing regarding the children. Other thing is routine immunization of children during these days. So there is no issue with the routine immunization. If a child develops the disease, so then it's better to wait for, there's no exact cutoff, but after 2 to 4 weeks of the recovery in the disease, they can have their usual immunization. So that should be continued. It is going on. So as much as possible, we have to encourage them to continue their routine, the immunization as well. So those are the special things in pediatric practice.
Parents may want to know. Parents may like to know when to admit and whom to admit, like which age groups they have to admit, and what kind of situation they should consider admitting the child.
Exactly, madam. So first thing is when this when this system is going on, still today also we discussed with the people who are doing this home-based management system, but still they are not prepared to do this home-based management. That means mainly currently the focus is with adults, but the thing is the children also, the number of patients, the children getting disease is getting high. So because of that, we also have to push for this home-based isolation. So that is decided by the MOH or the team who do this home-based management. But the alarming signs are the same as I mentioned earlier. The decision is taken by not the parents, actually the home-based management team. But if the parents has any concerns, we have to advise them to come to a nearest hospital as soon as possible. Currently, if a child is less than 2 years, they have to come to hospital. The 2 years little arbitrary cutoff age, but mainly this is taken as 2 years to be in safe side at the initial phase. But we are considering even, that neonates also we are discharging before completion of 10 days. But that's a decision of the clinician. But at a field level, if child is more than less than 2 years, they have to admit. Another thing is children with underlying comorbidities, chronic lung diseases, chronic liver disease, or renal disease, or any other chronic disease, especially immune deficiency disorder. Primary immune deficiency disorders are common in pediatric practice than in adults. So primary immune deficiency disorder or any form of acquired immune deficiency status due to disease. So disease manifest the treatment. And there are some neurological issues, chronic disability, like cerebral palsy, like that. Any chronic metabolic disease, any chronic disease, if a child is having other comorbidities, diabetes mellitus, and obese children, those also definitely have to admit, and the observation should be done in an institution. And then the signs, evidence of moderate or severe disease, or it may be other disease. So we don't know. Sometimes they might develop dengue as well, or it may be some other illness. So that is another thing. So if the fever is persisting more than 48 hours, If child is less active, refuse feeds, and reduce urine output, especially complain of abdominal pain, severe abdominal pain, vomiting. It's very difficult to say the numbers, but if it is persistent more than 4 to 5 times a day, loose motions, and development of new rash, or significant respiratory symptoms. That means apart from mild cough or sneezing, but if they notice the child is having some sort of breathing difficulty, definitely they should come to a nearest hospital. Those are the main indications to take institutional care, madam.
Okay, thank you, Chan. Thanks for the very comprehensive description of the issues with the kids. I think we put it into a simple language, Chan. Now, commonly asked questions. I think you have addressed that during your discussion. One thing is, if one of the parents is infected and child is, they don't know what's wrong. They don't know the status of the child. What kind of advice would you give if one parent is infected, then how to look after the child? And they are probably worried. They ask you whether to do a PCR on the child or an antigen on the child, or what red flag signs that they should be looking at home. You address those things, but just sort of give a little bit of a description on them.
Yes, sir. Yes. So one thing is, if a parent or any other household family member infected, so as much as possible, we have to take precautions. We have to advise the parents to take precautions to prevent the spread of the disease to the child as well. So even that, as I mentioned earlier, wearing face mask also not an issue for even children, especially the contact is less than 1 meter. But at least if they can maintain 2 meter distance, that's especially if they are in a closed room. Other thing is, as there's no specific thing for pediatrics, but the same precautionary measures, hygienic measures, hand washing, all these things should be practiced. If most of the time children are asymptomatic or mildly symptomatic, so if they are asymptomatic and well and feeding well, there's no need to do a PCR in early stages. But if they have become febrile or become having evidence of other upper respiratory involvement, sore throat, headache, and some older children might complain of anosmia as well. So this type of symptoms presents when at the onset of symptoms. I think it's better to inform the area PHI and the local authorities, because if an adult patient is at home, so this is a quarantine home, so they cannot go out by their own unless there is an emergency. So then the local this healthcare people will decide about the PCR. But I know there are a lot of pressures these days and a lot of waiting times, but that's a standard protocol. And if a child is remain asymptomatic, I don't think, according to the current situations, we should force them to do PCR or RAT. But if parents are really keen on that, they can have the disease. But ideally, if we want to identify whether this child is infected or not, it's better to do it around day 5 or 6. But that doesn't, if negative test, positive, no, it's okay. But if negative, it doesn't exude the disease, then again you have to repeat around 12 days. That's the same criteria for other patients as well. But most of the time, they are asymptomatic or mildly symptomatic.
Okay, thank you, Chan. So what you're trying to say is basically we have to reassure the parents when it comes to children whose parents are infected. Okay, so other question on the chat box is, suppose the mother is infected and baby is a breastfeeding baby who is not infected, can mother breastfeed?
Exactly. So this is a question we'll discuss since the beginning of this pandemic. But when the pandemic is going on, there are enough evidence that we can safely breastfeed. Even the baby is not infected. Even since day 1 of age, babies can be breastfed despite mother is having the disease state. But because the virus doesn't spread through the breast milk, but the same route as spread into the other patients who are respiratory route through the droplets as well as this close contacts. So it's obviously the close contact is there. So because of that, mother should take the precautions as much as possible. Sometimes might be fail, but as much as possible, mother should wear a appropriate face mask always when the breastfeeding. And before breastfeeding or touching the baby, mother should always wash her hands thoroughly, and as much as possible, she should keep the personal hygiene, as well as try to that usually this newborn babies that they are very fond of newborn babies, so this unnecessary contact should be minimized as much as possible, but definitely they can continue breastfeeding. Two reasons. One thing is breastfeeding, the breast milk doesn't transmit the virus. Other thing, even the newborn baby develop the disease, according to the current evidence, the chance of having severe disease is very, very remote. So because of that, breastfeeding with appropriate precautions, even the mother is positive of having active disease, is quite safe.
Yeah. Thank you, Channa. Other frequently asked question is, Channa, the mother who is breastfeeding, can she get the vaccine?
Exactly. So this is also there are a lot of concerns, but now we know pregnant mothers can get the vaccine after first trimester, and breastfeeding mothers, even exclusive breastfeeding mothers, can take the vaccine. And even just after taking the vaccine, she can continue breastfeeding. So there is no issue with the breastfeeding and vaccination. So because of that, we encourage the breastfeeding mothers to take the vaccine. If the mother had the disease, so then after 1 month of the PCR test, they can have the vaccine.
Okay. Yeah. Kalyan, you like to ask any other questions?
No, I think he covered almost all the important points.
Yeah. So can I just briefly tell about this MIS-C as well?
Yes.
Because
sure.
now pediatric community is aware about this MIS-C, but I'm sure that most of them are aware of this. This is a new disease. Initially identified around the world, around April 2020. So there were children with some sort of atypical Kawasaki disease-like picture, as well as toxic syndrome-like picture, increased frequency, and finally they have identified relationship with this coronavirus disease. And there were two terms. MIS-C is the term that used in America, that is multisystem inflammatory syndrome in children. Or again, at UK, it's termed as PMIS-TS, pediatric multisystem inflammatory syndrome temporarily associated with coronavirus disease. So there are a little bit difference in the diagnostic criteria, but our concern is this can develop in a children who develop this coronavirus disease of COVID-19. It's an immunological reaction. Because of that, it can develop very later, even complete recovery, even up to 6 weeks of the disease, they can have the things. Usually it develops after about 8 years to 21 years, but even before that age also, it has been recorded. So this is an immunological reaction, but the thing is, if we not properly identify it, it's a serious disease and very high rate of mortality if we not identify properly and treated properly. So the main concerns are they can develop fever and rashes, like Kawasaki disease. They might have red lips and red eyes, and even they can have the lymphadenopathy and some rashes, and especially we have noticed in our setup, they can present with abdominal pain, significant abdominal pain and diarrhea and vomiting. So GI symptoms are very common in these patients, especially our setup. And because of this, some of these children end up in surgical units, even undergone the appendicectomies or exploratory laparotomies, but finally identified this MIS-C because they can have myocarditis, coronary artery involvement, severe shock, and even if we are not diagnosed, can end up with death. So these days, especially a teen, especially a child over to 8 years of age, complain of these symptoms: abnormal skin rash, new development, red eyes, abdominal pain, especially vomiting and diarrhea symptoms. So that is also warning sign, especially if they contact you, especially the history of COVID-19. Sometimes even after recovery also they might contact you definitely straight away you should refer them to nearest hospital, because delay in diagnosis might end up with even mortality in children.
Thank you, Chan. I think that question was asked by Madhura, and this is organ failure happens after months of COVID infections in children. So that was addressed. Thank you, Chan. Other question is, Channa, now suppose there's an infected parents or the infected person at home. There may be other people who are actually immunocompromised or who are having a thalassemia trait. Is there a risk for these people who are at home with infected person?
Is it thalassemia trait or thalassemia?
Thalassemia, yeah, major and trait both, yeah.
Yeah. So I couldn't get the initial part of this question.
No, suppose there is an infected person at home, and also there may be people who are immunocompromised on treatment at home. And also there are people like thalassemia trait or thalassemia minor at home. So is there a risk for these people who are not infected at home?
Yeah, that is definitely there. So because even adults and children also, we have noticed that persons with underlying comorbidities have the highest risk of development of these complications. And even the children who are died in Sri Lanka too had leukemia, and one was severe obese child with came with diabetic ketoacidosis. So like that, there are some underlying issues as well. So because of that, because sometimes child might have the disease, but they might asymptomatic and can spread the disease to the other one. So vulnerable, if there are vulnerable groups at home, so best thing is encourage them to get the immunization vaccine as much as possible, as soon as possible, because now government is trying to cover all the people in the country above 30 years. So unless there is contraindications medically, but very unlikely, because these are all kill vaccines, even immunocompromised patient can take the vaccine. First thing is that. Second thing is children also. Now College of Pediatricians also proposed this, and now it's going on. The vaccination of children, especially children with comorbidities, as the first phase. So children with thalassemia also one of the early group of candidates which should require the vaccine when they start to give vaccine for children. And other thing was, this is another category we have identified, that children to vaccinate if there is immunocompromised patient or high-risk patient at home. But the thing is, even the vaccination of children might not prevent it, because children might have asymptomatic disease and spread the disease to the persons at home. So best thing approach in that thing is encourage them to take the vaccine as much as possible. So otherwise, it's very difficult to prevent the infection at home, because as we know, nowadays almost every person in the family, close household, develop the disease because of this high transmission rate of this Delta variant.
So in such a situation, I think probably there is a place for isolation, isn't it, if there is a high-risk group at home?
Yes, sir. So then the institutional management can be implemented. Yeah, if it is. So that's another thing. So this when we consider in, I forgot to tell that because there's no difference in pediatric practice. So the institutional management, when we consider children, we consider three aspects. One thing is age. Age should be more than 2 years, and child should not have underlying disease comorbidities, and then child should not have evidence of moderate or severe disease. Another thing is the social, the other background, the home environment. If child doesn't have proper isolation facilities at home, if there is no caregiver to look after the child 24/7, so there should be one-to-one contact or the observation. So there should be proper caregiver at home. Or if there is no proper communication facilities to contact the healthcare facilities if there is any problem, like that type of situations, that's also indication to give the institutional care.
Yeah. Okay. Thank you, Chan.